marijuana, pot, weed, herb, chronic, grass, bud, ganja, reefer, Mary Jane. In small doses, many people think that marijuana helps nausea and other stomach issues. But did you know that smoking too much of the devil's lettuce can also cause a severe vomiting illness called Cannabinoid Hyperemesis Syndrome, or CHS? Welcome back to another episode of the Real GI Doc Show. I'm your host, Dr. Fred Gandolfo, and I'm a board-certified gastroenterologist practicing in New York. Today, we're going to talk all about Cannabinoid Hyperemesis Syndrome. And the purpose of the episode is really to raise awareness about one of the rare side effects of heavy marijuana use. With legal and illegal use of marijuana on the rise, we're seeing more of this condition. And general awareness about this condition among doctors and lay people is low. So let's talk about CHS a little bit today, and we'll do this by talking about a case of a patient with Cannabinoid Hyperemesis Syndrome. As usual, I've changed some of the details of this case to protect patient privacy. I saw this patient a while back in the hospital for vomiting. He is a 22-year-old man, and he had episodes of vomiting and abdominal pain that lasted about 1 to 2 days at a time, and they were occurring frequently every few weeks or so. He eventually ended up in the emergency room, which is where I met him, because I was on call that day for the ER for emergencies. And he was trying to manage his issues at home with anti-nausea medicines that his primary care gave him, hot showers, and bed rest. But none of this was really working, and his parents brought him to the hospital because he was basically puking his guts out and was so weak and lethargic that he couldn't even get out of bed. So in the hospital, he ended up receiving morphine and multiple intravenous drugs to stop the vomiting, and he had a CAT scan of the abdomen and pelvis, which came back normal. His lab work showed dehydration and low potassium, and he was admitted to the hospital for vomiting and his need for intravenous hydration and potassium and pain control because he had lots of generalized abdominal pain. He underwent an upper endoscopy, which was normal, and further history that came from his parents was that the patient has anxiety and uses marijuana occasionally. When the patient eventually came to and started giving more of a thorough history, he admitted to using marijuana every day, sometimes a few times a day. And he started this when he was a teenager. But the vomiting issues didn't start till about last year, and they've been getting more and more severe since then. So what's the diagnosis here? Well, of course, it's Cannabinoid Hyperemesis Syndrome because this is the topic of today's show. But we didn't know this at the time, so we did this thorough workup and came up with really nothing. And given the history, it's reasonable to call this CHS. So what is Cannabinoid Hyperemesis Syndrome? Well, it's a subset of a broader disorder called cyclic vomiting syndrome. And what cyclic vomiting is thought to be, it's a chronic disorder of the gut-brain interaction. Cyclic vomiting syndrome is basically a vomiting illness that has criteria that you can use to diagnose it. And part of that is working up the patient for other conditions and making sure there's no more serious condition causing the vomiting. But also it has multiple episodes of vomiting that happen every year. And in between the episodes, the patient is doing okay. Sometimes they have some nausea, but there's no real vomiting in between episodes. So you go from normal to vomiting your guts out for a period of time and then normal again. And that cycle repeats itself at least a few times a year. And that's cyclic vomiting. So there's a few phases of cyclic vomiting. There's basically the interepisodic phase, which means that you're fine. This is when you're normal between episodes. You can have no symptoms, or you could have some minimal nausea or stomach upset type issues, but basically that's just when you're feeling fine. And then that goes into what's called the prodrome phase or the prodromal phase. And this is when you start to get symptoms, nausea, abdominal pain start to ramp up. It can happen over a very short period of time, a couple of hours or so. You start to get sweating, feeling hot, feeling cold. You start to get a panicky condition or a panicky feeling where you feel a little funny in the head, maybe a little out of control. And that's the time when you think the vomiting is going to start soon. And it's very similar to a migraine headache. When you suffer from migraines, which I do, so I can speak from experience, I have occasional classic migraines. You're fine most of the year, and then all of a sudden, you'll get this weird feeling. You feel a little nauseous, a little funny, a little spacey. You start to just feel miserable, and you know that the headache is coming. And this is very similar to that, except you start vomiting, basically. So you get this prodrome phase, and that's the time if you have medicine to take it. You can take medicines that will stop the vomiting. If you know that you have the condition, there's certain things that you can take, and they're similar to migraine medicines, basically to abort the upcoming vomiting phase, or it's called the emetic phase. Emetic means vomiting, so emesis is vomiting. And basically this is just like endless vomiting, relentless vomiting, retching, abdominal pain, all kinds of other unhappy feelings. Basically lots of thirst. You start drinking tons of water. You want to rest in a quiet, dark room away from people. And a lot of times you feel better after you vomit for, who knows, an hour or so, longer. Sometimes it's all day. And then you go into the recovery phase, which is when the vomiting kind of slows down. And now you're like, after the episode, you're recovering. You feel pretty miserable still because you're dehydrated, but you start being able to eat and drink and rehydrate yourself. And eventually you can go back to normal activities, and you go back to the interepisodic phase, which is when you're feeling fine. And then the cycle repeats itself. So that's cyclic vomiting. And with Cannabinoid Hyperemesis Syndrome, that's like a subclass of cyclic vomiting, and that's induced by lots of marijuana use. So the people who get cannabinoid hyperemesis, usually it's when they use some type of marijuana or cannabis for at least a year, but usually it's way longer than that. And they use it for at least most days of the week, so at least 4 days or more per week. Most people actually use it a lot more than that. They use it either every day or multiple times a day. It's usually heavy users. Usually you start years and years and years before the symptoms start. And the other classic thing that you see is that when you stop smoking or stop using marijuana, that the symptoms get better, but you have to stop for at least 6 months. So if you've stopped for 6 months and your symptoms go away and you met all the other above criteria with cyclic vomiting and lots of cannabis use, then there's your diagnosis. It's cannabinoid hyperemesis syndrome. And what does it look like to us as the clinicians? It looks exactly like we just talked about. So severe vomiting episodes, multiple episodes over the course of hours, severe generalized abdominal pain. People feel horribly sick. They come into the hospital often, basically like laying in the fetal position, vomiting, clutching their abdomen, complaining of intractable pain. Between the episodes of vomiting, they're often lethargic and sleeping or sleepy. They're weak, they're pale, they're out of it. When you try to take a history, they kind of give you weird, like, whatever, or like these weird answers. I just have pain. Like they just feel and look ill and sick. They're generally crappy looking. That's how I describe it from seeing this happening a lot in the hospital. It's generally a young, healthy person who now is acutely ill and just looks pretty terrible from their illness. And what happens is it takes a few days to recover after the vomiting stops. So after all this drama with the vomiting and the pain stops, you basically still don't feel great for a couple of days until you're able to eat again and you're rehydrating yourself. And so typically it's a few day hospitalization for this kind of thing. And oftentimes you see a parent sitting by the bedside saying, oh, little Jimmy smokes pot occasionally. I used to do it when I was young and I was fine. Something else is going on here. He's got some serious problem you need to work up. And we do work up. We do the whole workup because you just never know. Sometimes there's something else going on. There's an ulcer. Person has a bowel obstruction, there's a cancer, there's some other issue. So occasionally someone comes in with severe vomiting and pain and you find something else. But if they meet the above criteria, there's a good chance you're going to find cannabinoid hyperemesis syndrome, which looks normal. You do all the exam and everything looks normal. You do the CAT scans normal. So it's really a diagnosis based on some exclusion criteria and then just the clinical diagnosis that we talked about above. So what are the stats on marijuana use? And this goes back to 2019 data, because I think this is the last really good set of data that we had, which is pre-pandemic data. It was about 48 million people in the country use marijuana, and which is like regular users. And that's actually going up. Since the pandemic, people have been using more and more. And the other thing is that the THC concentrations, which is the active part that has the psychoactive properties of marijuana, the THC concentrations in marijuana that's available now is increasing. And people vape THC, and that also has an increased concentration of THC compared to smoking. And all this can lead to increased exposure to the active part of marijuana, although it contains many, many, many other substances that are active. THC is the main one, and that causes all kinds of issues. So the more of it that you're exposed to, the more likely you'll have some type of issue. So the take-home message here is that this is not the weed from the 60s and 70s that your parents used. Parents come in all the time saying, oh, my son uses marijuana occasionally. I used to do it when I was a kid. It's pretty harmless, not a big deal. And it may not be, but it also is not the same stuff as you were using, 50 years ago. 60 years ago? My God, it's so long ago. But it's not the same stuff that you were using a long time ago. A lot of it is more concentrated, it's more pharmaceutical grade, and it sometimes is laced with other stuff, but that's a different topic. And people are vaping THC concentrates or whatever it is, and it's causing all these kinds of issues to happen, this severe vomiting. So the typical patient who comes in with cannabinoid hyperemesis, if I had to pick a typical person, it would usually be a male. So it's about a 70% chance that it's a male. Women get this, but it's just less common. It's someone who's been using heavy marijuana use daily, usually, or most days of the week, often several times per day. Usually the patient started at using marijuana at the age of less than 16, so as a kid, and the duration of use is usually more than 6 years. So even though they started as teenagers and used heavily, the symptoms don't really happen until the 20s and 30s. And people who have withdrawal symptoms when stopping marijuana are often the same people who get cannabinoid hyperemesis. It's people who are heavy users and they have some type of chemical dependence that happens in the brain from heavy use. So if you get withdrawal when you stop smoking or stop using marijuana, that's often the kind of use that it takes to give you cannabinoid hyperemesis. It's usually not the casual person who uses marijuana occasionally on a weekend here and there. It's usually more of the chronic daily user. And why does it happen? So you have receptors for THC in your body anyway, and our body makes these, they're called endogenous cannabinoids, and they are basically things that your body uses to signal all kinds of stuff, and they're present in white blood cells, and they're present in the brain, and they're present in the gut, and they're present on epithelial cells, and they're present in neurons, and there's these receptors, and they're called CB receptors, which I'm assuming stands for cannabinoid receptors, because I don't know, the papers I looked at just said CB receptors. But you have these receptors in your body for these endogenous cannabinoids, and they do all kinds of stuff normally without having to use marijuana. But when you stimulate them using marijuana, it does stuff to your body. And basically, there's a lot of these CB receptors in your brain stem, and specifically in a place called the dorsal vagal complex. And we didn't really learn about that as much in GI fellowship, but we learned about what's called the area postrema, which is a place where it's called the vomiting center in your brain. So the area postrema is in your brainstem. It is a place where you have this area called the chemoreceptor trigger zone, and that's where if you drink some type of poison, your brain tells you start vomiting to get rid of this poison. So it's like sensing what's going on in your blood, and it's telling you if there's toxin in your blood, and it's making you vomit to help save yourself from some type of ingested toxin. So basically, it's a defensive mechanism if you stimulate neurons there, and there's a lot of these receptors, these CB1 receptors in the brainstem in this area that's responsible for vomiting. So if you stimulate these receptors in the brain, you puke. If you stimulate them chronically or enough or whatever it is, and if you stimulate the receptors, these CB1 receptors in the brain, you also lead to increased vagus nerve output. So the vagus nerve kind of controls it's a cranial nerve, and it kind of controls the gut. It's implicated in all kinds of gut motility, and basically is the way that the brain communicates with the enteric nervous system and the gut itself. So the vagus nerve, you're stimulating output there, you're causing vomiting in this case, and as well as you're inhibiting gastric emptying and gut motility. So you're slowing down the movement of contents through the stomach and the bowel, as well as stimulating vomiting. So you basically vomit your guts out if you're stimulating the CB receptors too much. And this doesn't happen to everybody who uses marijuana, of course, but there are theories that basically long-term use, heavy use modulates these neurons in a bad way, and you actually build up some type of chemical substance in your brainstem from heavy use that takes a long, long time to come out. And this is why you have to stop smoking for a good 6 months or so, or stop using for a good 6 months or so to really wash out the effect of the marijuana. So a lot of times what happens is people stop smoking or stop using, and they still feel sick a week or two later. So they say, oh, it wasn't that, and they go back to heavy use again. And that's just like not going to get them anywhere. So a lot of times when you're talking to someone with this problem, you have to really go through the facts that it takes months and months for the marijuana to kind of get out of your body. And it's a tough run because a lot of people go back to it in the time where they're supposed to be staying away from it, and they don't get better, obviously. So what are the complications here? Is it just puking, or can other stuff happen? Because puking itself usually is not, it's uncomfortable, it's horrible, but it's not really often dangerous. But stuff can happen. So from all the fluid and electrolyte losses, you can get dehydrated. You can get a kidney injury from the dehydration. Electrolyte imbalances are very common, so very low potassiums and other electrolytes, and this could be dangerous for many reasons. You get metabolic imbalances, lactic acidosis, and other issues from just low flow and low fluid in your body, severe dehydration. And very rarely you can have a very serious and even life-threatening complication from severe vomiting, and not just from cannabinoid hyperemesis, but from anything that causes very, very severe vomiting or really forceful retching. You can actually tear your esophagus or some other structure in your upper GI tract, and you can develop air in the chest and infection in the chest, which could be fatal, called pneumomediastinum, which leads to mediastinitis, which is an infection in the space around your esophagus, or where your heart is and everything else. And you can also tear or pop a air pocket in your lung and develop pneumothorax from the increased pressure from all the vomiting and retching. And that's obviously bad too, because your lung will collapse and you need to go to the hospital sometimes and get a chest tube put in. I mean, these are really uncommon things from vomiting, but you do see them occasionally. You often see them more in alcoholics who are vomiting, but anything that causes severe vomiting can cause this kind of issue. And really just the generalized healthcare utilization and other related issues like loss of productivity, loss of work productivity, vomiting all the time and being fired from your job because you can't seem to function in society when you're smoking weed 5 times a day. So all these things are complications of cannabinoid hyperemesis. And how do you manage this kind of thing? It's troublesome because the biggest way, or really the only way to effectively manage the actual cause of the problem is to stop using marijuana. And again, you have to stop for many months, and it's very hard to sell that to a patient sometimes because they don't believe you when they stop smoking and they feel bad still, even a month later. It's really a long-term cessation that you have to do. So you have to reduce the dose gradually if you're using it a lot, if you're using it heavily, because a lot of times if you just stop cold turkey, the patients will go right back to smoking or using because they feel crummy when they stop it cold turkey. So you have to slowly reduce the dose over the period of weeks or so, and then eventually stop using entirely. Now, without stopping, there's 100% recurrence, meaning everyone who gets this, if they don't stop and they continue to smoke as much as they do or use as much as they do, then it will recur. It just keeps happening forever. So it's a problem. Acutely, what do we use to stop the vomiting? The typical antiemetic stuff like Zofran, Reglan, it's kind of like so-so. It doesn't really work great for this condition. We give it anyway because maybe it helps a little bit, but some of the more heavy-duty stuff is often required. Benzodiazepines and actually Haldol or olanzapine, which are both antipsychotic medicines, which are injectable, which we give in the hospital, will often help quite a bit with the vomiting, but they also have side effects as well. We use topical capsaicin, which is the chili pepper or red pepper spicy stuff, and you could use that topically, and sometimes it helps to stop vomiting by stimulating receptors in your skin, which is pretty interesting. And people use compazine and other antiemetics, other heavier duty antiemetics, which often have some better effect than Zofran. But all this stuff is really just acute management, lots of fluids. People end up getting opiates in the ER or pain medication because of the pain, but you really want to avoid this long-term, especially because patients are prone to either getting addicted to it or dependent on it, and it doesn't really help the underlying issue. It just kind of puts a Band-Aid on it. So long-term, patients are out of the hospital and they either are stopping smoking or they're continuing to smoke. Anyway, what do you want to give to prevent these episodes? We actually use old-fashioned drugs like amitriptyline, which are tricyclic antidepressants. We use them for many GI conditions, but it actually may prevent some of the vomiting issues here with cannabinoid hyperemesis syndrome. And this is a drug that we often use for cyclic vomiting itself. Without the use of marijuana, amitriptyline sometimes can be a good medicine to keep cyclic vomiting at bay as well. Eventually, long-term therapy to treat the anxiety and depression that's associated with heavy cannabinoid use is probably the right way to go as well. So in addition to stopping, going into some type of therapy to really treat the underlying problem, which leads to or is often associated with significant cannabis or marijuana use, really anxiety and depression are the two things that are associated with with heavy use of drugs in general or marijuana, and treating that as the underlying cause is really the way to go. So therapy to fix the problem, sometimes psychoactive medications, whatever you need, that's not marijuana. especially if you are puking your guts out from smoking too much. So despite the above, many patients don't believe the issue is due to marijuana, and they end up bouncing around from hospital and doctor and never really getting the relief they need. And even when they do stop, unfortunately, the stats show that the relapse rate is very high, and lots of people go back to smoking and go back to vomiting and just live like this until they get sick of it, maybe sometime in their late 30s or 40s, and realize that it's time to move on and find a better hobby. So hopefully you liked this content, and if you know someone who's puking their guts out for no reason and they fit this criteria, perhaps it is cannabinoid hyperemesis syndrome, and they can get some help. But if you have a comment or a question, I would love to hear it. So please leave me a question using the link in the show notes below. You can leave an audio question. I can answer it on an upcoming episode. You can also contact me on social media at RealGIDoc and leave a question or a comment there. And until next time, try to stay away from the ganja as much as you can, and have a good week.
That's it for this episode of The Real GI Doc Show. Make sure to join Dr. Gandolfo next time to explore another interesting topic in gastrointestinal health. And remember, the views and opinions presented in today's episode are for informational and entertainment purposes only. Nothing discussed in this episode should be considered or used as a substitute for medical advice, diagnosis, or treatment. If you're experiencing a health issue, please consult with a doctor or a medical provider in your area. Thanks again for listening to the show.